So we continue with the development of the male and female reproductive system. This is part 3. External genitalia. The female and male genitalia are similar until week 9. The final form is usually not seen until week 12. External male genital organs. Development and differentiation are evident beginning at month 3 and are related to the action of the androgens produced by the testes. Genital tubercle initially seen in week 4 elongates by week 7 to form the phallus, which in turn will form the future penis. Phallus is as large in the female as in the male at this stage. Phallus carries with it urethral folds surrounding the phallic segment of urogenital sinus. The folds elongate on the ventral side of the penis to form the lateral walls of the urethral groove. Urethral groove is lined by an extension of the endoderm. Endoderm thickens as urethral plate. The genital folds, which circumscribe the median urethral groove, fuse along the ventral side of the penis from behind forwards at about 3 months, changing the groove into a duct of definite penile urethra. Penile urethra ends blindly just before the end of the penis. It is surrounded by a mass of erectile tissue of mesenchymal origin, that is the corpus spongiosum. Erectile tissue forms the end of the penis, that is glans penis. External urethral opening moves progressively towards the glans. Paid corpora cavernosa penis, also of mesenchymal origin, complete the erectile tissue in the shaft of the penis. Labioscrotal or genital swellings grow towards each other, fuse in the midline to form the scrotum. During month 4, the epithelium at the end of the penis forms 2 invaginations. At the tip of the glans, an ectodermal in growth forms a cellular cords, the glandular epithelial plate. Splitting of this plate forms a groove, that is glandular urethra, on the ventral part of the glans. It is continuous with the urethral groove in the body of the penis. Closer to the groove in the glans moves the urethral opening to the tip of the glans and joins the 2 urethral parts. The second invagination is circular and is called as preputial epithelial plate. Cleavage of this plate before birth separates glans penis from the prepuce or foreskin. It is a fold of skin at the tip of the penis which during week 12 grows over the glans and surrounds it. It is fused to the glans and not retractable at birth, but breakdown of the fused surfaces normally occurs during infancy. In embryo, the lack of Y chromosome development occurs slowly. Female gonad, which is initially undifferentiated, develops into an identifiable ovary at about week 10 of embryonic life, when its characteristic cortex becomes evident. The development and differentiation of the ovary are determined by the genetic constitution of its XX sex chromosomes. Primary sex cords are not prominent in the embryonic female gonads. Extend into the medulla to form rudimentary retive ovary. Both retive ovary and the primary sex cord normally degenerate and disappear. During fetal life, there is a proliferation of the coelomic epithelium into the underlying mesenchyme and the appearance of second growth of cords, that is the cortical, or also called as secondary sex cords. These eventually occupy the cortex of the gland. As the cortical cords increase in size, primordial germ cells are incorporated into them. By about week 16, the cortical cords begin to break up into isolated cell clusters called primordial follicles. These follicles consist of oogonia and supporting nutrient cells that form a single layer of flattened follicular cells derived from the secondary cortical or the sex cords. Their number is limited and about 3 lakhs to 2 lakhs, 3 lakhs to 20 lakhs are present. Of the initial stock of primordial follicles, approximately 300 develop between puberty and the menopause to produce fertilized ova. No oogonia form postnatally in the full-term humans. Although many oogonia degenerate before birth, those that do remain enlarged to become the primary oocyte. When the primary oocyte is surrounded by 1 to 2 layers of cuboidal, it is called the primary follicle. Most follicles remain quiet until puberty. The mesenchyme around the follicles become the ovarian stroma. After birth, germinal epithelium is continuous with the mesothelium or the peritoneum at the ovarian hilum. Germinal epithelium is separated from follicles in the cortex by a thick fibrous capsule called as tunica albuginea. Paramesonephric ducts in embryo with ovaries. The mesonephric ducts regress and the paramesonephric ducts develop to form the female genital tracts. The cranial unfused part of paramesonephric ducts form the uterine tubes. Caudal fused parts form a single median uterovaginal primordium at about week 8, which gives rise to the epithelium and glands of the uterus. The endometrial stroma and myometrium form from the adjacent mesenchyme. Fusion of the caudal parts of the paramesonephric duct commences caudally and progress up to the future uterine tubes. The median septum of the union disappears by end of month 3. Fusion of paramesonephric ducts brings together two peritoneal mesenchymal folds which form the right and left broad ligaments. Two peritoneal compartments of the peritoneal cavity, that is pouch of Douglas and uterovesical pouch. Between the layers of peritoneal broad ligaments on each side of uterus, the mesenchyme proliferates and differentiates into loose connective tissue and smooth muscle to form the parametrium. Gubernaculum caudal to the uterine tubes become the round ligament of uterus. Formation of the vagina. The terminal end of the primitive uterovaginal canal touches the posterior wall of urogenital sinus and forms the Mullerian tubercle or sinus. Mesonephric ducts enter urogenital sinus on each side of the tubercle. The posterior wall of the urogenital sinus thickens opposite the tubercle and with it forms the vaginal epithelial plate. From the plate, two solid invaginations called the sinovaginal bulbs grow and encircle the caudal end of the uterovaginal primordium or the uterine canal. Canalization of the vaginal plate begins at week 11, proceeds from caudal to cranial end, producing the lumen of the vagina, with the peripheral cells remaining as vaginal epithelium. Canalization is complete by month 5. Sinovaginal bulbs surround the uterine cervix to form the fornices of vagina. Vagina is of endodermal origin derived from the wall of the urogenital sinus. Paramesonephric duct form the body and cervix of the uterus. Vaginal lumens remains separated from urovaginal sinus until late fetal life by a membrane called the hymen. The latter usually ruptures during prenatal life. Buds from the urethra grow into mesenchyme and form urethral glands or the paraurethral glands of Skinny. Both correspond to the male prostatic gland. The outgrowth from the urogenital sinus forms greater vestibular glands of Bartholin. They are homologous to the male bulbourethral glands, that is Cooper's glands. Upper portion genital tract. After formation of the urogenital canal, the segment of each paramesonephric duct, which is cranial to the junction of the gubernaculum and the urogenital cord, becomes the fallopian tubes. The cranial openings of the paramesonephric duct, which open into the peritoneal cavity, become the fimbriae of the uterine tube. Mesonephric ducts regress almost completely, leaving only a short segment connected with the mesonephric tubes adjacent to the ovary, which persists as Epuheron or Rosenmüller's body. Gubernaculum, which is attached to the ovary at its caudal pole, becomes the proper ligament of the ovary. Genital or caudal region has two major parts. Pelvic portion of the urogenital sinus becomes less deep, bringing to the surface urethral orifice and the hymen. Pelvic portion is incorporated with the phallic portion to form the vestibule, which is surrounded by external genital organs. Phallic portion of the urogenital sinus is bordered by genital tubercle cranially and urogenital membrane caudally. After resorption of the membrane in week 9, the phallic portion of the urogenital sinus becomes open to the exterior. In the absence of androgens, feminization of indifferent external genitalia takes place. Cloacal membrane by week 3 is very extensive and its anterior end is level with the base of the umbilical cord. It is at this stage that the cloacal membrane is bordered laterally by two mesenchymal projections covered by ectoderm, which are paid primordia of genital tubercle. At week 4, the anterior end of the cloacal membrane retracts from the base of the umbilical cord, permitting formation of the anterior body wall below the umbilicus. The paid primordia of the genital tubercle come together in the midline to form the genital tubercle. New swellings appear. Genital swellings on either side of the cloacal folds and surround the genital tubercle and the cloacal folds. At week 7, the cloacal membrane is divided into urogenital membrane anteriorly and the anal membrane posteriorly, separated by perineal body, that is perineal body. Cloacal folds is divided into genital fold, which surround the urogenital membrane, and the anal folds, which circumscribes the ectodermal depression of the proctodium covered by anal membrane. Urogenital membrane in week 9 disappears. Thus, the phallic segment of urogenital sinus becomes open to the exterior. Differentiation of external genitalia takes place during month 3. Genital tubercle elongates only slightly and forms a clitoris. Urogenital sinus remains open with urethra opening anteriorly and vagina posteriorly within the interior of the vestibule portion of the sinus. Vestibule is bordered laterally by genital folds, which become labia minora. Genital folds or labioscleral swellings largely remain unfused to form the major labia majora. They do fuse posteriorly to form the posterior labial commissure and anteriorly to form elevation known as mons pubis. Thank you.